السلام عليكم. اليوم نكمل محاضرات الهيمودايناميك. راح نبدي بلكتشر 2. We will start with some definitions. We need to know what do we mean by hemostasis, and also we need to differentiate the two terms hemostasis and homeostasis. The difference is very trivial. Hemostasis means cessation of bleeding by formation of plaque, while the homeostasis هي ability or tendency to maintain internal stability to compensate for environmental changes. بمعنى أنه قابلية تكيف الجسم التكيف والمحافظة على الثبات الداخلي للجسم مع المتغيرات الخارجية من الانvironment like fever, or I'm sorry, the temperature of the body. The human body can keep the temperature around 37.2 degrees Celsius whenever we are in cold area or in hot area, except when we are sick. لكن in normal condition الجسم يحافظ على درجة الحرارة ثابتة بمختلف المتغيرات الخارجية. هذا أسميه homeostasis. الهيموستاسيس something completely different. It is cessation of bleeding by formation of platelet fibrin hemostatic plaque. The components of hemostasis, we have 3 of them that cooperate together to form the hemostatic plaque, and these are the vascular wall, platelets, and the coagulation system. Now, let me ask you a question. Do you think that a hemostatic plaque is beneficial or not? I think you're gonna say it is beneficial because it is happening in injured vessel, and this hemostatic plaque or the clot is going to fill the gap in between the two ends of the injured vessel. Now let's take an example. For example, you are in the kitchen and using a knife, accidentally you cut your finger. What are the sequences of events after that injury? First of all, the first response of the body is the release of endothelin mediator from the endothelial cells. Endothelial cells هي اللي lining of the vascular wall. راح تفرز لنا مادة اللي هي أسميها الاندوثلين will cause vasoconstriction، يعني تقلص بالوعاء الدموي as a response to decrease blood loss from the body. أيضا thrombogenic factors will be activated. شنو هي thrombogenic factors؟ Thrombogenic means factors تساعد على التخثر بالدم. normally احنا عندنا البلد moving in the vessels in a laminar fashion. Laminar fashion means all the cells are in the center away from the vascular wall. So any change to that flow will cause clotting formations. اللي أسميه this change of the flow أسميه turbulence of flow. So change in blood flow will cause turbulence and stasis which favor clot formation. Another factor is the release of tissue factor from the injured cells. هذا tissue factor will activate factor 7 اللي هو extrinsic pathway of coagulation. هذا اللي قلنا راح تاخذوه in more details with the hematology subject. Also, after the injury, we made the cut and we exposed the subendothelial collagen to the thrombogenic factors. فهذا راح يفعل لي الفاكتور 12 اللي هو intrinsic pathway of coagulation. عندنا von Willebrand factor will be released and attached to the collagen that has been exposed. والفون Willebrand factor وظيفته أنه هو attach to the platelet, facilitate the adhesion of the platelets. وأخيرا اللي هو normally الانdothelial cells تفرز لي anti thrombogenic substance حتى ما يصير عندي تخثرات بالحالة الطبيعية. فمن صار عندي الانجري راح تقل the release of these anti thrombogenic substances اللي هي prostacyclin, nitric oxide and tissue plasminogen activator and thrombomodulin. وهذا راح أيضا يكون عامل يساعد على التخثر بمنطقة الانجري. Here we have a picture summarize all the steps of hemostasis, and as we said that after injury we're gonna get immediate vasoconstriction and the activation of clotting factors through the release of mediators from the endothelial cells and the exposure of subendothelial collagen to the inside of the vessel. So apart from this and apart from the coagulation factors, we're gonna concentrate on the platelet role. And as we mentioned before that the platelets need von Willebrand factor to adhere to the vascular wall. These von Willebrand factors will attach to the subendothelial collagen, which make the platelets easily to adhere to the vascular wall. And after that, the platelets will undergo shape change and they will be activated. Also, they will start synthesis and release of thromboxane A2 and ADP. These two mediators are going to be potent mediator for aggregation of more platelets to the area of the entry. So more platelets will be recruited, more platelets will be aggregated and fill the gap. Here the platelet role has done, and now the coagulation will start forming the fibrin to strengthen the blood clot. So here the platelets role مثل ما قلنا الفون ويلبراند فاكتور وتتجمع عليها وثرومبوكسين A2 و more platelets and more platelets will aggregate on the gap وآخرها ال platelets bind to each other by binding to fibrinogen. The third factor in hemostasis is the coagulation. Here, the coagulative factors are produced by the liver, and most of them produced as inactive forms أو تسميها proenzymes يحتاج أنه تتحول لي إلى active form to start their function. In order for the coagulation factors to be active, they need to either exposed to subendothelial collagen or high molecular weight kininogen or kallikrein. These three factors activate the intrinsic coagulation pathway, while the extrinsic coagulation pathway is activated by the release of tissue factor. Now we will move to another subject, which is thrombosis. It is a very important one. We need to understand the underlying causes and the complications of thrombosis. So, what is thrombosis? We will start with the definition. It is an inappropriate activation of blood clotting in an uninjured vasculature, which means a blood clot when we don't have any injury to the blood vessel, or a very minor injury. So after that we will get blood clots. So now, do you think thrombosis is beneficial or not? I think the answer is going to be it is not beneficial as the clot, right? Because the clot is filling a gap in the blood vessel while the thrombosis, it is happening in uninjured blood vessel. The pathogenesis of Virchow's triad is related to three factors: the endothelial injury, which we said it is a minor one, and the abnormal blood flow. هنا عندنا an endothelial injury can lead to abnormal blood flow and vice versa. Also, hypercoagulability. All these three factors can lead to thrombosis. Now, let's move to one by one and take an examples for them. For the endothelial injury, the most common cause is the atherosclerosis. Atherosclerosis, most of the time we see it in the coronary arteries, and this will affect the vasculature to the heart. Everybody knows, which will lead to later on to ischemia and myocardial infarction. But for atherosclerosis, it is one of the most common causes for thrombosis. Why? Because atherosclerosis will cause minor injury to the vascular wall. Also, vasculitis and hypertension. All these three factors can lead to endothelial injury. The second factor in thrombosis or that causes thrombosis is the abnormal blood flow. خلونا بالبداية نعرف شنو هو النورمال blood flow على مود نقدر نميز الابنورماليتيز. Normally the blood flow in a laminar fashion. شنو نعني بيها؟ نعني بيها ال cells of the blood move in a concentric fashion. كل وحدة إلها خط وكل وحدة تمشي بانسيابية مثل الصورة اللي هي on the top. هذا هو laminar blood flow. لكن في حالة الابنورماليتيز اللي تصير عندي للفلو of the blood، هنا أنا راح تدخل عندي بمرحلة الثرومبوسيس. شنو هي الحالات اللي ممكن أشوف بيها abnormality للبلاد flow؟ ممكن يكون عندي stasis of blood like in veins in case of immobilization. ذول الناس اللي هم يكونون مثلا bedridden ما يتحركون، فبهالحالة راح يكونون at a very high risk of getting thrombosis especially in the leg veins بعد العمليات مثلا major surgeries or the مثل ما قلنا البدردن اللي هم الكبار بالعمر مثلا وصلوا مرحلة ما يقدرون يتحركون. ذول هم at risk of getting thrombosis due to stasis. The other mechanism هي ال turbulence of flow بحالة ال arteries مثلا in case of aneurysm. هذا أيضا يؤدي لي إلى turbulence of flow. والثيرد one هي ال hyperviscosity of blood بحالة البوليسايثيميا فيرا. هذه البوليسايثيميا فيرا ممكن اللي يصير بيها زيادة بالفيسكوستي اوف بلاد. هذا شيء يؤدي إلى الستيسيس، والستيسيس بدوره يؤدينا إلى الثرومبوسيس. Now, what are the mechanisms behind stasis and turbulence of blood flow to cause thrombosis؟ يعني صار عندي stasis وصار عندي turbulence of flow، وليش صارت عندي thrombosis؟ الأسباب هي التالية. When we get turbulence of flow، هنا شنو اللي راح يصير؟ The platelets will be in contact with the endothelium. احنا مثل ما ذكرنا قبل قليل بالسلايدات السابقة، قلنا البليتلتس من يصير عندي endothelial injury or exposure to the subendothelial collagen راح تجي البليتلتس ترتبط لي والفون والبراند factor and will start formation of the clot. فهنا the same idea, disruption of laminar flow will bring platelets in contact with the endothelium. أيضا من صار عندي مثلا stasis معناها البلد is not flowing very well in the area. فهنا شنو؟ عندنا الكلوتينج فاكتورز موجودة بالبلد، فلما ما صار عندي flow للبلد بالمنطقة هنا ايش راح يصير؟ راح تبدي تتراكم الكلوتينج فاكتورز، وهذا راح يؤدي لي بالنهاية إلى الcoagulation and clot formation. أيضا عندنا الكلوتينج فاكتور inhibitors ما راح تقدر توصل للاريا، ف this will lead to build up of thrombus. يعني صار عندي ثرومبس بسبب الكلوتينج فاكتورز، والانهبيتور اوف ذا كلوتينج ما تقدر توصل، فماكو عندي شيء دا يعاكس لي الكواجوليشن، فراح تبدي الثرومبس تكبر وتتكون build up of the thrombus. ايضا الاندوثيليوم لما تكون داير مدايرها الزياده بالكونستريشنز اوف ذا سيلز، البليتلتس اللي تجي ان كونتاكت ويا الاندوثيليوم، هذا كله راح يؤدي لي الى activation of the endothelial cells وتؤدي لنا ايضا الى local thrombosis. Third risk factor for thrombosis is the hypercoagulability. What do we mean by hypercoagulability? زيادة أو فرط بقابلية الدم للتخثر. For hypercoagulability, it is either primary disorder, means a disorder in blood that will cause hypercoagulation, or secondary to another disorder in the body. For the primary ones, عندنا mutation in factor V laden. What do we mean by or why factor V laden mutation can lead to hypercoagulability? احنا قلنا for a blood clot to be formed after any injury، قلنا مثلا after cut injury راح يصير عندي vasospasm or vascular response, then the platelet will take part in the clotting formation, and after that the coagulation system will start its function and complete the fibrinogen formation and the clot formation. So one of the factors in coagulation is factor V. So it is a coagulation factor. This is first. And for the coagulation in the body, we need to have checkpoints or an opposing factors. يعني ما أخلي الجسم يسوي لي clots ويصير عندي coagulation without an opposing factor حتى أعادل الأمور. يعني معناها راح يبقى الجسم يسوي coagulation and all the blood will transformed into a big clot and everybody will die after any minor injury. We have checkpoints or balance points اللي هي تعاكس لي مفعول ال coagulation factors. One of these factors هم protein اسميه protein C. So protein C is an anticoagulant factor. فنرجع لما يكون عندي mutation in factor 5 اللي راح يكون عندي اسمه factor 5 laden، بهالحالة protein C is not able anymore to counteract the effect of factor 5. And in this case, factor 5 will continue forming its function as a coagulation factor. بهالحالة الجسم راح يكون more vulnerable for coagulation and clot and thrombus formation. This factor found in 25% of Caucasian population and 60% of DVT patients. وغالب المرضى اللي عندهم factor 5 laden mutation ألاقي عندهم recurrent thrombosis, recurrent DVTs تبديلي بعمر مبكر more than the secondary causes مثلا. يعني ألاقيهم بال30 سنة قبل 30 سنة هم دا يبدي عندهم coagulation in the body and recurrent cases of DVT. مرات حتى ألاقي عندهم الكلوت in unusual sites. يعني إحنا غالبا نلاقي deep venous thrombosis in the legs، بس هنا أنا راح ألقاها حتى بالأورجنز، ممكن ألاقي عندي الثرومبوسيس موجودة. So this is for the primary disorder. We said the mutation in factor 5 laden, and the second one is inherited mutation of antithrombin 3, protein C and S. Those will lead to venous thrombosis and recurrent thromboembolism in adolescent and early adult life. بهالحالة هنا the defect is not in the clotting factors but in the anticoagulant or anti-clotting factors. يعني بالحالة الأولى إحنا البروتين سي هو ما في أي مشكلة و it is functioning، فلذلك لما صار عندي مشكلة في فاكتور 5 سميت الحالة functional deficiency of protein C. يعني مو هو فعليا ما موجود، وإنما الفانكشن مالته هي اللي صار عندي بيها خلل، لأن ما دا يقدر يشتغل على فاكتور 5. لكن بالحالة الثانية لا، احنا عندنا الديفكت بأنتي ثرومبين 3 C and S. This is for the primary disorders. For the secondary disorders, we have obesity, oral contraceptive pills intake, neoplasia, pregnancy, advanced age, and tissue injury. All these will lead to زيادة بقابلية الجسم للتخثر. And later on for thrombosis. And later on to thrombosis formation. Now for simplicity and to be easily reminded, احنا عندنا قلنا ال Virchows triad. It is 3 factors that form the thrombus. ال VI هي ال vascular injury, R is the reduced blood flow or abnormal blood flow, and the CH نقدر نخليها HC اللي هي hypercoagulability. So it is so easy to be reminded. According to the morphology and site of formation of thrombus, they have divided thrombosis into 4 major or 3 major types: the venous thrombi, arterial thrombi, and the valve thrombi. And a 4th group has been added just for distinguishing between the pre and post-mortem thrombi. راح نتطرق له ضمن الشرح. So the venous thrombi هنا سوينا جدول حتى نقارن ما بين الفينوس and the arterial. venous thrombi أيضا أسميها phlebothrombosis. In general, venous thrombi, it is either in the deep veins or in the superficial veins. بالنسبة للsuperficial veins غالبا نلقاها بالlegs, in the saphenous vein, occlusion of the vein راح يؤدي لي إلى congestion, redness, tenderness, والarea تكون very vulnerable to trauma and infection. لكن risk of embolism is very low in comparison with the deep venous thrombosis. In deep venous thrombosis هذه راح تكون عندي thrombi in the large veins like the popliteal, the femoral, فهاي تكون either above or below the knee. بحالة ال DVT أو اللي هي deep venous thrombosis هنا ال risk of embolization is high وال pain و tenderness is less than the superficial, بحيث sometimes it pass unrecognized وتشخص retrogradely يعني after death of the patient by embolism to the lung. هنا راح نبدي نرجع retrograde ونعرف شنو الكوز، يكتشفون انه هو كان deep vein thrombosis. فهذه معلومات لكم حتى تعرفون شنو الفكرة العامة من الفين ثرومبوسيس. لكن اللي أريده من عندكم تحفظوه هو التالي. بالنسبة للفين ثرومباي occur at site of stasis. وين ما ألاقي stasis of blood قلنا مثل البedridden after major surgeries راح ألاقي الفين thrombus almost invariably occlusive، يعني في كل الأوقات هي occlusive تسد بالنسبة للفين ثرومباي. any thrombus when it is formed first راح يصير عندي بيها propagation. فالpropagation of venous thrombi راح تكون toward the heart و in direction of the blood flow. Gross and microscopic, it is a fairly uniform cast containing abundant RBCs with fibrin strands. غالبا تكون red thrombi، وبما أنه هي area of stasis فقليل أشوف what's called lines of Zahn اللي راح نشوفها بالarterial thrombi، لأنه lines of Zahn تحتاج لها high flow area. فبالنسبة للvenous thrombi it is less prominent than in arterial thrombi. مثال عليها قلنا DVT. نتحول إلى الموضوع الآخر اللي هو الارتيريال ثرومباي. بالنسبة للارتيريال ثرومباي راح تكون عندنا at site of endothelial injury like in case of atherosclerotic plaque, endocarditis, or in case of turbulence of flow like in vessel bifurcation. Typically تكون عندنا non-occlusive بحالة النيورال thrombi. What do we mean by neural thrombi? They are the thrombi that formed in either the heart chamber or in the aorta. هذا معنى النيورال thrombi. فإذا typically the neural thrombi are non-occlusive. لكن إذا كان عندي thrombus in a small artery it can be occlusive like in the coronaries. And in case of arterial thrombi the propagation راح تكون عندي also toward the heart لكن بهالحالة راح تكون retrograde from the attachment point and يعني راح تكون عكس اتجاه ال blood flow not in the direction just like the venous thrombi. بالarterial thrombi lines of Zahn are very prominent. What do we mean by lines of Zahn? هي تكون الثرومبس عندنا مثل المقلمة. عندنا layer red اللي هي تتكون لي من ال RBCs و alternating with a pale layer اللي متكونة من platelets and fibrin. هذا ينطيني lamination للكلوت وأسميها lines of Zahn. It is very prominent in the high flow area. يعني احنا نعرف انه الارتريز هي تتميز بانه هي high flow area او يعني الارتريز تكون اعلى من الفين. فاللاينز اوف زان are very prominent in case of arterial thrombi. مثال عليها thrombus over atherosclerotic plaque. هذه الصورة تبين لنا اللاينز اوف زان اللي هي الدارك area متكونة من RBC alternating with pale area fibrin and platelet. وهاي alternations اللي بالثرومبس سميناها lines of Zahn. هنا هذه الصورة تبين لي الميورال ثرومباي. الميورال ثرومباي قلنا هي either in the heart chamber or in the aorta. بالنسبة للpicture on the left side هذه هي both ventricles موجودة عندي الثرومبس over fibrotic area and in the right side راح يبين لي aneurysm aortic aneurysm and they have cut it and we can see the thrombus with alteration of lines of Zahn. ننتقل إلى الموضوع Postmortem Clot. From the name it means after death, clotting of blood after death. This type of clot should be differentiated from the antemortem. عندنا بعض النقاط اللي هي first of all occur after death and no attachment to the arterial wall with characteristic shape للكلوت اللي هي تتكون لي من two layers. the bottom layer فقط RBCs تكون red واللي يسموها current jelly والupper layer تكون supernet of plasma شكلها yellow just like a chicken fat. فهذا الشكل مال الكلوت يميز عن الانتيمورتم اللي قلنا بيها lines of Zahn. هنا ما عندنا lines of Zahn. أيضا هذه الكلوت it should be differentiated from other type of thrombus especially the venous one لأن ذكرنا الفينوس not very prominent lines of Zahn. همينة قلنا ممكن تكون فقط red. فهنا راح أقدر يعني أخلي ببالي differentiating point ما بين postmortem clot والantemortem especially the venous one. يعني إذا أجانا MCQ postmortem clot is confused with arterial or venous لا راح تكون with venous one. هذا جدول ينطينا ملخص لنقاط الديفرنشيشن ما بين antemortem and postmortem. مثل ما قلنا الادهيجن للوول والcolor والline Suzanne. The fourth group of thrombosis is the valve thrombosis. Valve thrombosis, it will affect the valves of the heart. خلينا نعرف شنو اسم الفالف thrombi. يسموها vegetations. So any thrombus on heart valve أسميها vegetations. In general, it is of one of three types. Either infective endocarditis, هنا عندنا a previously damaged valve, will be attacked by microorganism, either bacteria like streptococci or fungi. These will attack the valve and will cause even more damage to the endothelium. Will this cause propagation and formation of clot. هذا أسميه non-sterile vegetation. ليش؟ لأنه هي بيها microorganism, so it is non-sterile type of vegetation. The other type هو non-bacterial thrombotic endocarditis. This will affect heart valves without damage. يعني أنا عندي valve ما بي أي damage لكن عندي hypercoagulable state in the body, so it will cause formation of clot on the valve, وبهالحالة أسميها sterile vegetation because there is no infection. The third type أو اللي أسميه Libman sac, هذا يصير بحالة systemic lupus erythematosus. مثل ما الكل يعرف ال SLE is an autoimmune disease, يتكون بالجسم immune complexes. هذه immune complex will attack the heart valve and will deposit there, cause inflammation and scar formation. So this type is also sterile vegetation. The outcomes of thrombosis. In case the patient can overcome the attack of thrombosis, so after days to weeks, we're gonna see the outcome or the fate of thrombosis, which is either thrombolysis, and this is the best one, means shrink and total lysis of a recent thrombus. We should concentrate on recent thrombus because the older thrombuses undergo fibrin polymerization and cross-link, and these thrombi become more resistant to proteolysis. That's why in the emergency department, when we receive patient with heart attack with MI changes on the ECG, we can give them the thrombolytic agent within 6 hours of the attack. After 6 hours, it is not beneficial and no role for the proteolytic agent. This is explained by the fibrin polymerization. So as we said, this is the best outcome of a thrombosis. Also, we can see propagation of a thrombus, mean enlargement of thrombus, and this can cause vascular occlusion and infarction. Sometimes the thrombi dislodge from their place and migrate to a distant site, and either piece of them can go to a distant site. In this case, it's called embolism, like in case of deep vein thrombosis with embolism to the lung with pulmonary embolism. Also, organization, which means ingrowth of endothelial cells, smooth muscle cells, and fibroblasts into the fibrin-rich thrombus. So the thrombus is going to be part of the vascular wall. This is called organization. The last one is recanalization, which means channels will be formed in the mid of the thrombus itself, and this is going to provide us with a way to pass the blood from the two ends of the thrombus and establish the continuity of the original lumen. So these are the outcomes of thrombosis and we should know all of them very well. هذه هنا صورة تبين لنا outcome of thrombus. هذه microscopical picture on the corner, on the lower corner تبين لي recanalization. نشوف شلون صار عندي هذه الفراغات البيضاء الواسعة، هي هاي الريكاناليزيشن اللي صارت لنا بالثرومبس. والصورة الفوق هي جامعت لي ما بين الاورجنايزيشن اللي قلنا هي ingrowth of endothelium smooth muscle fibers and recanalization، بداية الريكاناليزيشن. Now the last subject for today's lecture is disseminated intravascular coagulation, or DIC. It is a sudden or insidious onset of widespread fibrin thrombi in the microcirculation, which cause circulatory insufficiency, especially in the organs brain, lung, heart, and kidneys. What are the characteristics of such condition? First of all, we should put in mind that it is a secondary condition and not a primary disease. So it is secondary to tumors, to obstetrical complications, and also after infections. So DIC, it is a secondary rather than a primary disease. What's happening in DIC? There would be widespread coagulation, and in this case we're gonna consume platelets, coagulation proteins, so the body will be exhausted of the consumption of the coagulation factors and the platelets and will pass into what's called consumption coagulopathy. Then the body is not going to only watch, but the body will have action against the widespread coagulation, and the fibrinolytic mechanisms will be activated, and eventually serious bleeding disorder will arise. So DIC is consumption coagulopathy with fibrinolytic mechanisms lead to bleeding, and also it is secondary and not a primary disease. شكرا جزيلا لاستماعكم، وصلنا لنهاية المحاضرة وإن شاء الله تكونون استفادتوا.